Hello guys, welcome back to my channel. My name is Steven, a registered nurse, and on this channel I simplify complex nursing topics to help you pass your exams and become very confident in your clinical practice. Today, we are going to be breaking down one of the most tested topics in medical surgical nursing, hypertension. In this video, I will explain the definition, classification, pathophysiology, clinical factors, and nursing management, and also the complications in a very simple way. At the end of this video, once you understand the topic properly, I guess you'll not be able to miss hypertension questions in exams again. Let's begin. Hypertension is defined as a persistent elevation of blood pressure greater than or equal to 140/90 mm per mercury in adults, 140 for the systole and 90 for the diastole. Take note, it is not just a one high reading. It must be sustained value over time after 2 or more checks, preferably 2 or more perceives. Hypertension is often called the silent killer because many patients have no symptoms until the complications occur. That's why we as nurses, we must always take note of the BP monitoring. Moving on, we have the classifications. Now let's talk about the classifications. For part 1, we have normal blood pressure, which is less than 120/180. That is 120 for the systole and then 80 for the diastole. We have the pre-hypertension. In this case, it ranges between 120 to 139 for the systole and then 80 to 89 for the diastole. Always take notes. For stage 1 hypertension, is between the range of 140 to 159 for the systole and 90 to 99 for the diastole. Finally, the stage 2 hypertension, we have 160 and above for the systole and 100 and above for the diastole. In exam questions, you might see cases such as 168/102 mm per mercury. That is the stage 2 hypertension. Always take note, they usually test you in cases like this. Next, we have the pathophysiology. Now, this is where many of us get it confused, but I'll simplify it. Blood pressure depends on 2 major factors, which are the cardiac output and the peripheral vascular resistance. If either of these 2 increases, the blood pressure rises also. So just imagine if water is flowing through a wide pipe and then the pressure is normal. But once you press down the pipe together and the pipe becomes narrow, pressure increases. In hypertensive cases, blood vessels become narrowed or stiff and then pressure increases. Another important mechanism for the pathophysiology is the RAS system, the renin-angiotensin-aldosterone system. When the RAS system is activated, angiotensin 2 causes vasoconstriction and then stimulates aldosterone release, which in turn causes sodium and water retention. Sodium and water retention will lead to more blood volume, and then more blood volume will increase the pressure of the blood. So hypertension occurs due to the increased peripheral resistance, increased blood volume, and also increased cardiac workload. Over time, this tends to damage the organs. Always take note, hypertension is not just IBP, it is a progressive organ damage. Next, we have the risk factors. The risk factors are divided into 2 major parts. We have the non-modifiable and the modifiable. Non-modifiable are those that cannot be controlled by the patient or the nurses. We have age, the genetics, family history, and also ethnicity. These 4 are non-modifiable. For the modifiable risk factors, we have obesity, high salt intake, smoking, alcohol, stress, and sedentary lifestyle. These I mentioned are the types of risk factors that can definitely be attended to by the nurse or the patient. It can be controlled by changing lifestyle. As nurses, our biggest role is to modify these modifiable factors. Always take notes. Moving on, we have the clinical features. Most patients are asymptomatic when it comes to hypertension, but when symptoms will definitely occur, they might include headache, especially the occipital lobe, dizziness, blurred vision, epistaxis, and chest pain. However, always take note, symptoms usually appear when complications have started already. Never rely on the symptoms when you are trying to detect hypertension. Always do the BP monitoring. Next, we have the complications. This is a very important section of hypertension. Uncontrolled hypertension tends to damage some target organs, such as the brain, the heart, the eyes, and kidneys. For the brain, it might lead to stroke. For the heart, it might cause left ventricular hypertrophy, heart failure, or even myocardial infarction. And for the eyes, it might lead to retinopathy. And for the kidneys, it might cause chronic kidney disease. That's how dangerous hypertension is. It silently destroys organs. Lastly, let's discuss our role in this case. For the nursing management, we have monitoring the BP regularly. This is a very vital part, as I've explained earlier. Administering the antihypertensives as prescribed. You also monitor for the side effect of the drug and educate the patient on lifestyle modification. Always encourage the medication adherence to the patient. Tell the patient to use the drug at the appropriate time, and then monitor for signs of complications. For the lifestyle advice, we always inform the patient to lower their salt diet, attempt to try to reduce what they eat to avoid obesity and lead to weight reduction. Always inform the patient to exercise well, avoid smoking, and also reduce alcohol intake. The more you educate the patient, the more it prevents complications. Talking about the complications, we have what is known as hypertensive crisis. This is when the BP is greater than 180/120, with symptoms like severe headache, blood vision, and chest pain. In many hospitals, they have different ways to attend to hypertensive crisis. Always take note of your hospital zone. Quickly, let's do an exam style scenario question and see if we've been able to learn. A 55-year-old man presents with BP of 182/116 ml/mercury and severe headache. He also complains of blood vision. What is your priority? Correct answer is assess for hypertensive emergency, prepare for urgent intervention, and monitor the BP regularly, recording each time you measure. So in conclusion, today we've been able to cover the definition, classification, pathophysiology, clinical factors, obligations, and nursing management of hypertension. If you are able to understand hypertension like this, you are already ahead in your exams and clinical process. If this video helped you, please like, share, and subscribe. One simplified nursing masterclass video coming very soon. I'm Stephen RN, and I will see you in our next video. Thank you.